My name is Michael Rubino. I'm on a personal mission to make sure you don't get sick inside your own home.
I knew there was something wrong. I'm just so relieved there's something that you can do about it.
Hello. Thank you for joining me for another episode of Never Been Sicker. I'm your host, Michael Rubino, and today's very special guest is Dr. Suzanne Gilberg. Dr. Suzanne Gilberg is the Chief Clinical Officer of MonarchMD, author and founder of Menopause Bootcamp. Dr. Suzanne Gilberg, thank you so much for taking the time to be here today. I know you are a busy gal. You have a lot going on, and I just really appreciate you being here.
Oh, same, Michael. I'm really happy that we're finally doing this.
I know. For those that don't know, we've played some podcast tag, which may be everybody, right? So this is a divine right here.
Yeah, kind of crazy. Yeah.
But we're finally here, and thank you so much for making this happen. So I would love, this podcast is called Never Been Sicker. You and I already connected offline. We had a great conversation. We talked a little bit about, environmental toxins, the role that plays. I think you've been around, you've seen it all. I would love to hear from your perspective, what you're seeing out there, how important environmental toxins is to this holistic health puzzle here. And is it the missing link, in so many health complications?
I mean, it's such a great question. And I think back, you and I have been having these, we initially met, I feel like it's almost a year ago, and so much has changed in that time in terms of even just our own knowledge and how much more obvious things are. And I think the two things that I would note that have really changed and become so much more present is the amount of data that is being published on microplastics and how they not just like, oh, that seems like it's probably not good for us, but like specific data showing impacts on our health. So things from incorporation in amniotic fluid, incorporation of microplastics into clots that have been removed from carotid arteries from individuals who have had strokes. I mean,
wow.
It's chilling. Honestly, it shouldn't surprise us because we are consuming these things. And so I think that would be one big category. And the other one is I'm in Los Angeles, and honestly, the fires here that we experienced and the amount of questions that we all have about how our environment has been affected, everything from soil to water to runoff to air quality. This is not a wildfire. This is not a forest fire. This is like a lot of stuff, everything, housing, energy sources, every kind of building material, chemical you can imagine being released into all of our environment with limited capacity to understand how to even measure it, and how long it would take to remediate. People are moving quickly to want to move back into homes and rebuild, which I completely understand. I have a very close family member who lost everything, lost their home, and wants to rebuild there. I'm not going to say anything about it. I had cousins that were visiting from out of town yesterday, and they really wanted to go to Venice Beach. They had happy memories of Venice Beach. And I was like, you guys go to Venice Beach. Absolutely don't take your shoes off. Don't walk on the sand.
Yeah.
You're not getting near the water. And they were like, what? I said, do you know the geography? I mean, so I could go on. There's all this like stuff going on with these weird blooms in the ocean from everywhere from San Luis Obispo, which is about 3 hours north of here, to San Diego, which is about 3 hours south. And all of these whales and sea creatures washing up on the beach, dead. Now, is it just an algae bloom?
Yeah.
I don't want to sound like a crazy paranoid person, but like we had the biggest wildfire in the history of, I believe, the United States, right? The number of structures in an urban setting. How could that not be affecting the sea life? So I don't want to be like doom and gloom, but like we really need to be understanding the significance of this and our part in it, how we are playing a part. And then the other thing that may surprise people is that we didn't talk about, I mean, I think you and I talked about it, but so I'm conventionally trained. I'm board certified in OBGYN. I was board certified in Integrative and Holistic Medicine. That grew out of my training in Ayurveda. So I was trained in an accredited program in the early 2000s in Ayurveda, which is the ancient medical system of India, very similar in many ways to Chinese medicine. I think people in this country are more familiar with Chinese medicine because it's regulated in this country. But, most indigenous holistic health systems and Ayurveda specifically talk about our role as part of nature, that we are one, we are nature, that we're not separate from nature. And when you have these crises, it becomes really evident, right? Because we're, like, do I need to really define it anymore? We're breathing it in, we're exhaling it out, like we are part of nature. So what we do affects nature, nature affects us, not because we're separate, but because we are an organism. And that holds the key to, I think, solutions and healing, actually, because when we start to realize, like, we're not going to separate ourselves and we're going to be in a bubble and we're okay, but the whales are dying.
Yeah. Good point. And, it's interesting, kind of talking through this. Yeah, I know you made a comment like, I don't want to sound like crazy or doom and gloom. And I get that aspect. But the reality of the situation is when all of those homes go on fire, the amount of chemicals that get released into the atmosphere, the amount of microplastics, right? The amount of arsenic, heavy metals, lead.
Yeah.
I mean, these homes.
And you can't even measure a lot of that stuff.
No, some of these homes had asbestos, right? That gets distributed across the environment.
Yeah.
Lead paint. I mean, no one's understanding the impacts of how this leaches into the environment and how it impacts human beings in that environment, other animals in that environment, and of course the marine life in the nearby ocean, right? And so, no, I don't think it's crazy at all. I don't think it's far-fetched at all. I mean, there's a lot there that unfortunately, is going to be very, very difficult to clean up properly.
Yeah. Yeah. It was very disturbing in the early days because the Air Quality Management District was like, okay, it's measuring fine now. And people were like, is it though? Because you guys acknowledge that you don't know how to measure a lot of what was released. I mean, it was very, I spoke to friends of mine in New York City during and after, and one of them said to me, look, this is in many ways, in terms of the environmental impact, it's your 9/11. Not to make light of any of these things, right? But like, just understand that what we didn't understand. It took us many years and a lot of illness and a lot of heartache to understand how we had been exposed. And you guys need to understand this right now. Right now. So, and I didn't know if my N95 was going to work, but I was wearing one. I wasn't going, I'm a big like outdoor person. It's LA. I exercise outside. No. Until that first rain came.
Yeah, no, and it was smart to do that. I mean, just like you pointed out with 9/11, obviously, it's similar in nature, right? You have all those contaminants, but bigger, of course. Yeah, but you have those contaminants that escape into the environment. Yeah. And we saw people get cancer. We saw people get very, very sick after 9/11 in the vicinity. I mean, I lived in New Jersey at the time. And the smoke literally was dissipating and traveling into the state of New Jersey. I mean, that's how much, those contaminants spread and traveled. And so it's really important, that people are aware of this. Again, not to be an alarmist or doom and gloom, but what you're breathing in really matters. And if you stick your head in the sand and you're not paying attention to this, you're going to be the adverse effect of this, right? Yeah. And so we talked about microplastics, heavy metals. What other environmental toxins do we want to be aware of and have control over?
Well, I mean, I'm not a environmental toxin expert. So, I mean, those are the ones that come to mind the most prominently to me. I think living in Southern California and growing up here, I remember smog days and really you could see the air. It was pretty bad in the 70s. And there would be like days like we couldn't go out on the playground. So I think that was, and maybe that sensitized me early on, honestly, Michael, because I grew up with that. And it was like kind of like the butt of jokes, but it was like a very serious issue. And the thing is that, a lot of air quality controls, especially emissions from vehicles and fuel sources, became very, very much the focus of attention, at least in this part of the country. And we saw a massive reversal. So here's the thing. When there are partnerships between government and industry that are informed by actual science and public health, you can make changes. You can clean up the air. We saw during the lockdowns in the early pandemic days, the air quality in Los Angeles radically improved in a very short period of time, just with the loss of fossil fuel emissions. That's it. It was incredible. It wasn't just like it looked better, like there were measurable differences. And I have to say, that was remarkable to me during that time. And I was very surprised and actually heartened by it, because I thought, wow, there are things that we can do that can change and have an immediate impact that will have a long-term health impact on all of us. When we know that, like, if you just talk about emissions, it's not just like, oh, it's pretty, it's gross. I mean, we know that rates of asthma, rates of obviously of any kind of lung disease, cancers, but asthma in children, and especially if you look at human beings who are less advantaged, who live closer to large highways and things like that, they're even more vulnerable and more exposed, which is why often in poor communities you see higher rates of lung disease and specifically asthma in children, and those can be altered. So the thing is, we just have to have the will to do it. We have to have the science to inform our decisions and the will to do it, and because it's not a pipe dream, it's something that we can have an impact on. And I think it starts with the small changes. And unfortunately for us, the way we seem to function as humans is we seem to require some kind of a trauma to, make a decision that, like, oh, wow, this is really happening. This is really bad. What can we do about it? Yeah. Right now, people are so overwhelmed by the amount of information that's coming at them, and just like the environment politically, honestly, in the country. And I think the binary of it, like somehow wellness is getting it's just kind of crazy and chaotic. And so I understand that the response, there's the fight, flight, freeze response. So a lot of people are going to freeze. And I think what we need to do is nurture ourselves into it doesn't have to be fight or flight. It can be like, okay, what is the small thing that I can do for myself in my home, for my family? And then for those people who are motivated to do so or have that talent, really speaking, pushing for policy reform, stuff like that, because it does make an impact.
Totally. No, I agree that it does. You mentioned asthma earlier, and we haven't talked about the M word, mold, yet. So I'm excited to kind of cover that, because 22% of all asthma cases are caused by mold, and we know that asthma is more prevalent in some of these structures in certain socioeconomic classes, right?
Yes, and so older homes and older apartment buildings that don't get cleaned, that have older materials. That, look, if you live in an environment literally where you don't have control over how the building is being maintained. I don't know, you may know the numbers, but I bet there's huge amounts of mold in these buildings.
Oh yeah.
And these are people who can't afford to remediate or fix it. And their landlords are non-responsive.
Totally. Yeah. And that's a huge part of the issue. Right. And, just going back to mold for a second, I know, talking about the Menopause Bootcamp and MonarchMD, curious for you, what have you seen with regards to mold and mold exposure? I'll tell you a little bit about what I've seen. And it seems to me that women seem to be more disproportionately affected or more sensitive to mold for whatever reason. And so would love to unpack that.
Yeah, that's so interesting. I'm not a mold expert either, but my take on that is probably that mold, amongst other things, is going to stimulate a cascade of inflammatory response, right? So the inflammatory response, I feel like people talk about this and they don't really fully understand it. The inflammatory response is our body's response from the immune system, which is an alarm system. It's actually here to protect us. It's alarming, hey, this is, for instance, a foreign invader. This mold particle has come into our lungs or been absorbed through our skin and is it's not us, and we need to contain it, and we need to remove it, right? So that's what the immune system is designed for. The inflammatory system is part of that. It's the early warning, and it's a good thing. It's not a bad thing. If you think about, you have exposure to a virus or bacteria and you get a fever. A fever isn't bad. A fever is your body's response literally to contain that and burn it up. I mean, I'm really simplifying this, and remove the toxin. So, but the problem is when you have chronic exposure and your body is constantly responding and can never turn itself off or downregulate, or maybe you're not even being exposed to this anymore, but for whatever reason, your immune system has been ignited and it cannot calm itself down. Now you're having other downstream effects because your body is not designed to constantly be inflamed. And you're getting disruption in neurotransmitters, you're getting disruption in hormones, you're getting disruption in your gut microbiome, the microbiome and the symbiotic relationship that we have with bacteria, which is healthful, gets disrupted. So we're more susceptible and vulnerable to other toxins. And I feel like these are all these key words that have been sort of weaponized against us. Like if you use the word toxin, you're somehow not a real physician. And it's like, what do you know? This is like how physiology works. So mold is doing that. And if you have chronic mold exposure, you can't get out of the environment and it's always mold, and your body's like, this is not good for us. Now your body is very busy trying to put out the fire that the mold has started and doesn't have as much energy to fight actual other toxins that are coming into your environment. It's also exhausting you. It's exhausting your resources. Now, when you talk about women have a natural inflammatory response when they're cycling, because part of creating the lining of your uterus, releasing the lining with your menstruation is inflammation. Again, another way inflammation works in our body in a physiologic way. If you build up the lining of your uterus, don't get pregnant, you need to release it for the next cycle. Inflammation is part of that. That's inflammation that's healthy. But so you can see that our hormone levels also are varying and have a different relationship with these inflammatory molecules. So perhaps this is one of the reasons that we might be more vulnerable. We have hormonal variations and fluctuations that are physiologic with both starting our periods, menarche, what we call menarche when we're in puberty, with having our periods, with stopping our periods if we get pregnant, with suppressing our periods if we're breastfeeding, with perimenopause where there's a designed unpredictability as our ovaries wind down. Every time you have a shift or a change in your hormone cycle, that may create more vulnerability. I don't know if anybody has looked at this or studied it, but that may be why women are more susceptible. I wouldn't be surprised. And estrogen in and of itself, estrogen isn't one thing, that's actually a couple of different molecules, but estrogen can be anti-inflammatory or pro-inflammatory depending on the receptor it's binding with. So that's how the hormone travels around your body and affects your brain or affects your heart or affects your uterus, like we just talked about, or affects your breasts. There are alpha and beta receptors, and they do different things. It's also the lining of your blood vessels, really, really important when you look at cardiometabolic health. So, depending on how that lock and key relationship is being manifested, mold specifically could be disrupting that relationship. And I'm theorizing here, but maybe it's shifting us into a more inflammatory state overall with our hormones.
Yeah, there's a, shifting out of just mold for a minute and kind of switching back gears over to just overall air quality and overall environmental toxins and that exposure, which obviously can be food toxins as well. Just sticking on women's health for a minute, I've actually seen some cases. I mean, I wouldn't say it's very common, but the early onset of menopause and this relationship with environmental toxins, food toxins, just how does this play overall into menopause in general? It seems to me like it could potentially cause earlier onset of symptoms or maybe intensify some of these symptoms. What's the relationship there?
Yeah, again, I mean, we have so little information on this to begin with. Just to level set with you, the National Institutes for Health devotes about 11% of their entire budget to women's health, all women's health, all of it. And less than 1% of that is devoted to menopause. So Let me just start with that caveat because
Wow.
there's only so much that we know. So we don't even have we have a lot of basic information, to be honest, but to get into the weeds about mold and menopause, now I'm going to go look for some studies, but I have a feeling there's not very many. So just so the audience understands, when I say we don't know, we don't know. Okay. Having said that, understanding how mold impacts, for instance, mast cell. Okay, I think mast cell and histamine, which are allergic responses, again, a very specific part of the inflammatory response that I was just talking about. And mast cell is kind of like the thing now, and it's definitely a thing. And I'm seeing a lot more patients coming in with mast cell activation syndromes in perimenopause. We've already known for a long time, and I think this is where I'm drawing on sort of my basic understanding and theorizing. We know that women who have autoimmune disorders, for instance, okay, where your immune system is attacking itself. So lupus, Sjogren's syndrome, psoriatic arthritis, rheumatoid arthritis, people I think are familiar with these.
Yep.
We know that women who have either a predisposition to autoimmune disorders or have autoimmune disorders, multiple sclerosis is another one, they tend to have more severe and more frequent flares during perimenopause. Do we completely understand it? No, but it goes back to what I just said. As your hormone levels start fluctuating more unpredictably, you're up and down, up and down, up and down. And women who menstruate, who have these disorders, already can tell you that their flares often will coincide with where they are in their menstrual cycle. So now you get into perimenopause where things are all over the place. You can understand why that interaction might be really poisonous. So I think that plays into a lot of what you're talking about and why people tend to have more problems in perimenopause. Now, whether or not this could induce earlier perimenopause or an earlier menopause, I don't know, but it certainly could exacerbate the common symptoms of menopause or perimenopause. And it also can become very confusing because is this perimenopause? Or is it mast cell activation? Or is it lupus? What is it? It's kind of hard to say. And I don't know that there's a way to tell, honestly, because we don't have a great mechanism to track other than clinical symptom recording, like you coming in and telling me. So when I talk about these symptoms, what am I talking about? Mood disruption, a lot of anxiety coming up out of nowhere, depression, especially fluctuating, sleep disruption, vasomotor symptoms, which are the most classic, right? Hot flashes, night sweats, night flushing, but heart palpitations, which can be part of that, and then mimic anxiety. And so is it anxiety, or is it a heart palpitation, or is it a cardiac issue? Okay, skin changes, dry mouth, dry mucous membranes in general. All of these things you could see in a person who is having a problem with mold exposure. Brain fog is a huge one. Cognitive changes, that's a huge one. And it's so hard to unwind. And I think in the end, you need to have a clinician who's really sensitive to actually listening to your story. You need to have some tools in the arsenal to measure some biomarkers. And by the way, hormones are not necessarily the biomarker to follow. Looking at inflammatory markers might be more beneficial. And then has enough experience and confidence to approach this with a nuanced plan of care, which is involving anti-inflammatories, detoxification, and hormone therapy. Because, if I give you hormone therapy and these 5 things improve, but these 3 things don't, okay, so that's not it. We need to dive deeper, and vice versa. I'm coming at it more as a menopause expert, right?
Yeah. So you just pointed out some really good things. There are so much that we don't know, right? Pretty crazy for me to learn today that only 11% of resources get put into women's health and less than 1% of that is for menopause. That's pretty mind-blowing. Although it doesn't really surprise me because when I studied the appropriations for air quality and saw how little we spend on studying air quality, it was pretty alarming considering how much air we breathe. Yeah. However, I'd like to talk about what we do know, right? So we do know that environmental toxins can cause inflammation, right? Mm-hmm. And we do know that there's a role that inflammation can have on menopause. We do know that there's a role that inflammation can have on perimenopause, right? Women's health in general, hormones, et cetera. So let's talk about that for a minute. What role does inflammation play on that? And, if I'm dealing with some of these things, what might I want to do to try to reduce my inflammation?
I mean, that's such a big, broad topic. If you're talking about overexpression of inflammation, I think just clinically speaking, people's disrupted life experience is enormously important. But also something to keep in mind is that I sort of mentioned this before. Estrogen, and specifically estradiol, in the right proportion is actually anti-inflammatory. So as we start to have these wild fluctuations, because in perimenopause, Michael, we're going to have our highest levels of estradiol outside of pregnancy and our lowest levels in the space of one cycle. I wish I have this picture that I show my patients, which I should send you. But it gets really, really unpredictable, right? So if you are not experiencing more often than not estradiol in a very specific range that will not induce inflammation, you can see how now inflammation in a bad way is being promoted. Now, we're using inflammation generically. If you look at what happens postmenopausally, so now our estradiol is completely low unless we're replenishing it. What are the medical issues outside of, forget environmental exposures that are problematic, that are, by the way, making all of this worse? Our number one risk factor, or our number one risk for mortality and disease as humans and as women, is heart disease, cardiovascular disease, which is largely a disease of inflammation. Basically, the lining of your vessels is inflamed because of a number of problems. The loss of estrogen increases that even more so. So now we add in environmental exposures that are also inducing inflammation. You can see how this is leading us down a very dangerous pathway if we don't address those things. So, from my perspective, one of the things that I can do is, first of all, look at these things earlier, not waiting for women to be 65 and have a diagnosis, have diabetes, which is an inflammatory issue, have early dementia, which is an inflammatory issue, have heart disease. One of the reasons that I changed my practice is to give us the opportunity to start looking at prevention, looking at biomarkers much earlier in life, looking at things like, HCRP and SED rate. This is pretty basic stuff, but a lot of people don't look at it. But also lipo(a), ApoB. These are more cardiometabolic, but they're inflammatory markers. Look at them early on. Now, what's going on at 40 that we can prevent you from having the disease or the manifestation or the complication or the death at 65 or 75? I mean, this is really basic stuff that doesn't get done. It just doesn't happen. And it doesn't happen not because people don't care. It happens because I think the population isn't necessarily so educated about it, and doctors don't have time to address this. They don't have time to learn more about it. And when you take insurance and you're seeing 35 patients a day, and you're doing their pap smear and getting their mammogram and, whatever, treating their urinary tract infection, you don't have time to answer this question, or you don't even want to have it asked because you probably don't have the answer. You didn't have time to read on it.
Right.
It's one of the reasons I left, the kind of practice I was in. And I never disparage my colleagues because they are suffering in a system that doesn't care about prevention either.
Right.
To leave and to try to start educating myself even more deeply and taking the time with patients to look at, okay, what's going on with you right now? What's your history that might inform some of your risk factors? Pregnancy history is very, very important in terms of predicting future health. Where do you live, right? Who has time to ask about mold exposure in a 7-minute encounter? You don't.
Yeah, that's true. And I'm glad you brought that up because, a lot of people do, they complain about the medical system and feel like the medical system has failed them. And, people are getting sick and they're asking questions. And, sometimes instead of just saying, hey, I don't have the answer, you might want to go see a specialist. They can get gaslit, just because, it's a way to be dismissive and, next, and let's talk about something and steer the conversation what I want to talk about. And so, there's a lot of that happens. And I think, the reality of the situation is if I'm a patient and I'm dealing with something, I would appreciate having this answer of, hey, I don't really know. That's something out of my wheelhouse. You might want to go to somebody else. But just to know the truth is, hey, doctors are extremely busy and they don't have time to research everything there is to know about everything. And, we obviously put a lot of stress on medical professionals to, we expect them to know everything that there is to know about everything. Right. And so I appreciate that explanation. Right.
Yeah, it's really interesting. And I think you said something really powerful, which is the 3 words, I don't know. I have had the opportunity to say that many times over the course of my career. And sometimes it surprises people that that's one of my favorite sayings, because I can't possibly know it all. And I do want people to have the opportunity to get information, whether or not I have the information. I think one of the problems for us in our training is that we are, honestly, the training system is miraculous, amazing, and quite toxic. So we are trained that we need to sort of know everything. I don't know, or maybe we feel defensive about it, or it's like especially when you're in your residency, like a lot of what you do really is life or death. And so I don't know isn't an answer. But once you get out into your practice, then you do have to you have to really make sure that you are exercising humility, because I think patients don't expect us to know everything. They expect us to be empathic and supportive. And, I think the other thing here is that if we didn't learn it in medical school, or it seems a little bit out of the box, then people can get defensive about that too. And that's when they get dismissive. And then you get gaslighting. I don't think anybody who gaslights means to gaslight. I just don't. They're not necessarily so super aware of themselves. And I learned pretty early on that it was just better to just be honest with the patient and try to help refer or get a creative solution. And it's actually what spurred me to learn more. And it's really what moved me to study Ayurveda, because I felt like there were just so many things that weren't being addressed in my conventional training. And I practiced in a fully conventional setting until 3 months ago. It's not like, I was attending staff at Cedars-Sinai Medical Center. I was in a big, private practice where I was doing conventional medicine. I'm not doing conventional medicine now either, by the way. I still basically grounded in conventional medicine, just that I was always kind of curious about other stuff. And I was interested in what my patients had to say. And my patients guided me often. They would come in, and because then I wasn't being judgmental. I was really curious. And then they would bring me stuff that they weren't going to tell anybody else. And then I got a reputation for being open-minded to stuff. And I learned a lot.
Well, that's how I learned. Curiosity, right? I think it's so important to be curious, That's
how we all learn.
Yeah, absolutely. Now, shifting gears a little bit, I want to talk about MonarchMD. I want to talk about the Menopause Bootcamp. Tell us your story of what you're doing, what you're accomplishing. You're still grounded in conventional medicine, but you've switched up your practices. Fill us in. Where can we find you and work with you?
So I think I alluded to this, or I talked about it maybe, but I spent 22 years, 26 years. I don't know, I'm losing time with math, but 20-ish years in a very large conventional OBGYN general practice, right? Now, I was doing all this other stuff on the side and became much more educated in menopause and perimenopause, which we really didn't learn much about in my training. Because I had this background in holistic medicine, I was interested in botanicals and things. And so I always was doing things differently. And I decided to make the move into this concierge membership practice so that I could have more time to devote to what my patients were interested in, needed, and prevention strategies, and then bring in some of these other more integrative and holistic modalities. So that has been incredibly satisfying and really restored my faith in my choice of profession. I mean, I was really, really burnt out, like so many of my colleagues. Like, I really understand the burnout thing and the pressure of seeing so many patients and feeling like you can't really do what they need and feeling like you're exhausted and it's like take. It's just terrible. And it makes you just not want to practice anymore. A lot doctors specifically are leaving clinical medicine for this reason. The system is very, very abusive toward us, financially, spiritually, medically. Everything's getting questioned, prior authorizations. You can't get what you need. I can't provide what you need. We're empathic humans to begin with. That's why we did this. It's just a disaster. And honestly, me being able to partner with Monarch, which is a medical services platform. So they help identify what your patient population wants and needs, and then move you into that practice, right? So I own my practice. I own and operate my practice. They're a vendor that I partner with, and they do all the stuff that I'm not good at: regulatory, legal, business services, that kind of stuff, helping with the patient process, helping to create the model that's going to work in order to allow doctors who serve women who are missing that big gap, that 40 to 65-year-old gap that I was talking about, because that is getting lost. And there's data on this, okay? To serve that population in order to improve their health and their outcomes, and also our health and our outcomes. Physicians have the highest rate of suicide of any profession, and female physicians actually the highest.
Wow.
Yeah, it's really terrible. So, I did this to save myself. And now I'm really excited to be involved in helping to really come outside of a paradigm that's quite broken and create something new and better for the patients and for the physicians. So I was working with Monarch as an advisor. We decided I would be the first practice to make this change. And now we are offering this service to other doctors. So for me to help educate the public so that they understand, look, doctors and patients are actually in the same position. Often we kind of are the repositories for people's frustration and anger because you waited for 2 hours in my office and then insurance didn't pay this. And the issue is insurance in corporate medicine. We're getting affected too. I think it's becoming more obvious to patients that it's not us versus them. It's us versus them.
Yeah.
We're the face of medicine, but it's like, we're not making these decisions. We're getting abused as well. So it's really, really beautiful for me to be able to be part of a healing process. I see this as another process of healing myself, frankly, healing my patients, and helping to heal my colleagues. I could not be more thrilled at this point in my career to have this opportunity. And it's interesting because we're in a moment that's very, very chaotic and difficult and scary and painful. And I'm an optimist. I feel like something really beautiful can come out of this as long as we have people who are willing to be courageous and express their vision and make sense about it. I'm great with ideas and my team is great with execution, to be perfectly honest. I mean, I'm good at executing my medical plan, but I don't want to run a business, and you don't want me to run a business. You really don't.
That's incredible. And I'm an optimist too, so I'm right there with you. Tell us about Menopause Bootcamp.
Oh my gosh, Menopause Bootcamp, my baby. As I was really learning more about perimenopause and menopause and becoming more known in the community for this, people were asking me so many questions, and I realized I just was not going to be able to educate them in the way that they deserved or needed in a short encounter. And this was happening anytime I gave a talk, or all the hands would shoot up at the end asking me about hormones and bioidenticals and what did this mean. And I had a public conversation. I was interviewed by a media personality who's a good friend, and she's 20 years younger than me, and she interviewed me publicly about menopause, which I thought was so interesting. This is 5 or 6 years ago, kind of ahead of her time, right? And during that conversation, I realized, oh, wow, not only am I it's just, in my office, I don't have time, but we lost the thread. There's an intergenerational conversation between younger and older women that is not happening. Women don't know. Women know. Kids are taught about puberty. There's books and shows and education at school. And then we get into our, whatever it is, 35 plus, and nobody's talking about it. And people are going through major changes and have no idea what's happening. And I couldn't let it go. And the name Menopause Bootcamp, I swear to you, I was driving, it was very LA. I was driving around. I can tell you exactly what traffic light I was at. And it just went into my brain, Menopause Bootcamp. You need to do a Menopause Bootcamp. I don't even know what it was, Michael. And I made it up. And I created programming, 3 to 4 hours of programming, level setting. Here are the definitions so that we're speaking the same language and you know what's going on with your body. Here are the problems that I see and that I experience as a woman. and that we have data on. Here are solutions from a variety of traditions: my conventional, my botanical, my holistic, my integrative, and here's fitness that we can do together to help increase our longevity, right? In a very evidence-based but fun, safe environment. I thought people were coming for education. I was doing these live in Southern California. They were coming for community. I did not, that the community is what drove it. And then we had the pandemic and everybody went online and it exploded. Nobody was really talking about this.
Yeah.
And I wrote a book. It was published and it came out at the end of 2022. And then all of a sudden everybody was talking about it. So I don't do the boot camps as much as I used to, although I will be doing an extended boot camp in Rhinebeck, New York at Omega Institute in August, which is going to be so fun. And I train others to do the boot camp. So I have a certification program and I train facilitators, non-medical facilitators, to go out into their own communities, serve their own communities' needs. And it's really exciting. We do quarterly coaching and we have women Puerto Rico, Ohio, all over the country, Canada, doing these boot camps now, educating ourselves, empowering ourselves so that we can advocate and help move the change. And this is a grassroots effort. I knew from the beginning, us getting what we needed wasn't going to be wagging our finger. It was going to be having to come up as a groundswell. And it wasn't going to be top down. It wasn't going to be from academics down. They are doing research and we appreciate them. But it's the human beings who are being affected who have to rise up and say, hey, this is what's going on with me. This is what I need. And this is what I deserve. And that's, I've been watching it happen. It's crazy. In my wildest dreams, I never would have imagined that there'd be something online called the Menopause, that I have girlfriends. A lot of the social media influencers that people follow are friends. And somebody in my group, one of my multiple threads, because that's what's all over my phone all day, Michael, we have like 10 million followers if you put us all together.
Wow. Mm-hmm. That's incredible. It's so inspiring. You have to tell us the name of your book, by the way.
Oh, well, the book is called Menopause Bootcamp. So the book is called Menopause Bootcamp. Spoiler, I'm negotiating another book, but I'll tell you when I have official word. That's really exciting. And it's more about my roots in botanical medicine. But yeah, Menopause Bootcamp, it's a great primer for people who want to understand just what's going on and have a more integrated approach to how to move through that in a more comfortable, educated, supported way.
That's amazing. So you have the book, you have the community, you bring everybody together, you're educating. You've got a live event coming up in Rhinebeck, New York in August. That's really exciting. Congratulations on everything you're doing. Where can people find you?
I think, I'm most active on Instagram. You can go to my website and find all of my social links, and that is thedrsuzanne.com. So THDRSUZANNE.com. And the bootcamp certification is there, and my practice. So if you're in Southern California, I'm getting close to a wait list, but my practice is here. I'd love to see you. And I love engaging. You can see the smile on my face. I love engaging with people and hearing what's happening with them and helping them find what they need.
That's amazing. Well, thank you so much for taking the time to be here to share your wisdom with us, talk about everything you're doing, bring us up to speed. Really excited for your new book. I know it's not official yet, but very excited for that.
I'll come back and talk about it.
We'll come back. I'll have you back to talk about that soon. Thank you so much.
Oh, thank you so much for having me, Michael.